Picture the absolute worst moment of your life. A car crash. A sudden, terrifying medical emergency. Into that whirlwind of noise, fear, and utter confusion, a calm, focused presence arrives. So today, we're going to pull back the curtain on the people who literally build order out of chaos. Paramedics.
You feel it, a sudden pressure right in your chest, a pain that starts building, and then it radiates out into your left shoulder, and then a wave of sheer panic washes over you. And look, this isn't just some textbook description. These are the terrifying classic signs of a heart attack, a moment where your entire world just shrinks down to the size of your own frantic heartbeat.
So, who are the people who step into these moments? The ones who stay calm and systematically go about the business of saving a life? Well, that's exactly what we're going to dive into. How do they do it?
All right, so where does it all begin? What's the foundation for these incredible life-saving skills? Let me tell you, it's a whole lot more than just a basic first aid course. We're talking about hundreds of hours of intense, specialized training.
In Germany, they have a specific term for them, a Rettungssanitäter, basically a highly qualified paramedic. And listen, this isn't a title you just get handed, it is earned through a super rigorous 520-hour program that ends with a tough state exam. This is a deep, deep dive into the science of saving lives.
And just think about the sheer amount of knowledge they have to cram into their heads. In just 160 hours of classroom theory, they've got to master everything from anatomy and physiology to pediatrics and even the complex legal stuff that governs every single move they make. They're basically part doctor, part logistics expert, and part lawyer, all while working under the most extreme pressure imaginable.
Okay, so when they arrive on scene, it all boils down to the basics, the vital signs. And one of the very first, most critical pieces of data they grab is the heart rate. You know, the number of beats per minute. It's like a direct window into how well the body's entire circulatory system is or isn't working. For a healthy adult who's just resting, the sweet spot is right around 60 to 80 beats per minute. But this isn't just some random number. It's the baseline. It's their ground zero. Any major swing away from that baseline is an instant blaring red flag.
But here's the thing. Normal isn't a one-size-fits-all deal. Not even close. Just look at the difference here. A newborn's heart rate is nearly double what an adult's is. What's perfectly healthy for a tiny infant would signal a massive crisis in a grown-up. Paramedics have to have all these different norms memorized for every single stage of life.
So once they've got a handle on the vitals, they need the tools to actually step in and do something. And that brings us to their next critical skill, using their pharmacological toolkit against the ticking clock.
You know, the way most drugs work is actually a pretty brilliant and simple idea. It's called the key-lock principle. The drug itself is the key, and it's perfectly designed to fit into a very specific receptor or lock on one of our cells. When that key slides into the lock, boom, it triggers a very specific action. It's kind of like targeted hacking of the body's own systems to get things back in balance.
And of course, how you get that key to the lock matters a lot. Taking something by mouth, the enteral route, means it has to go through the whole digestive system. And that's slow. In an emergency, you just don't have that kind of time. That's why they use parenteral routes. They completely bypass the gut and go straight into the bloodstream, like with an IV, for an almost immediate effect.
But with incredibly powerful drugs comes immense risk. To make sure no mistakes are made under pressure, they follow a super strict safety rule, the 4 eyes principle. It's simple. One person prepares the drug and labels the syringe. Then, before it goes anywhere near the patient, a second person has to independently check everything: the drug, the dose, the label. It's a simple but absolutely life-saving checkpoint.
Let's make this real. Take a common emergency drug, propofol. It's a powerful sedative. It works by latching onto receptors in the brain to calm the whole central nervous system down. Now notice 2 things. The effect is immediate, but it only lasts for about 5 to 8 minutes. That gives paramedics incredible control. But just as important is this last row, the contraindications. These are the situations where this powerful tool must absolutely not be used.
Okay, so treating the patient is one thing, but a huge part of a paramedic's job is actually controlling the entire scene. So how do they walk into total chaos and create order? The answer lies in a set of battle-tested emergency protocols. At the very heart of their strategy is something called the command cycle. It's a mental model that forces them to take deliberate, calculated action. Assess the situation, plan your options, decide on the best course, then give the order. This isn't just some checklist, it's a circuit breaker for panic. It ensures every single step is thought out, even when seconds feel like hours. And a massive part of that process is getting the right information back to dispatch, and getting it right the first time. Their very first radio call has to be sharp and to the point, and it covers 4 critical things: who they are and where they are, what's happening, any specific dangers on scene, and exactly how many patients they have. This one radio call sets the entire emergency response system into motion.
All right, now we're getting into the moments where the stakes are at their absolute highest. These are the scenarios where all the training, all the protocols, and all the teamwork get tested to their absolute breaking point. This is when every single second counts. 100 to 120. That's the magic number. It's the rhythm of life during a cardiac arrest. That's the speed you need to go with chest compressions to manually pump the heart and force oxygenated blood up to the brain. And if you need a way to remember it, just think of the beat of the song Staying Alive. No, seriously.
And then you have one of the most technically demanding skills in their entire arsenal: intubation, which is securing a patient's airway. And this quote really says it all. It's an incredibly perishable skill. To stay good enough to have an 80% success rate, a paramedic needs to do this procedure between 70 and 100 times a year. It takes constant, relentless practice to nail it when it matters most.
And then, you have the events that push the entire system past its breaking point. In Germany, it's called a MANV, or mass casualty incident. This isn't just a busy shift. This is a scenario where the sheer number of injured people completely overwhelms all the available resources. It forces a total shift in thinking, away from treating individuals and toward managing a large-scale disaster. And that requires a whole different command structure just to begin to tackle the chaos.
So far, we've talked a lot about the skills, the drugs, and the protocols. But for this last part, let's look past all of that, at the person inside the uniform. What is the psychological toll of this job, and what systems are even in place to protect them?
I mean, how do you even begin to cope with that kind of psychological weight day in and day out? Well, one of the key survival tools is something called radical acceptance. This quote kind of reveals it. They have to truly understand that they are walking into a crisis that has already started. They can't always change the outcome, and accepting that hard truth is what helps shield them from the crushing weight of self-blame when things go wrong.
You know, it's interesting, they also lean heavily on principles borrowed from another high-stakes profession, aviation. It's called Crew Resource Management, or CRM. And these aren't just suggestions, they are core principles. Communicate safely. That means speak up if something feels wrong. Have doubts? That means you're expected to double-check everything. It's all about building a team that is so resilient that it catches human error before it can become a tragedy.
Which really brings us all the way back to our final question. What is it that protects those who protect us? Well, it's not just a helmet or a pair of gloves. It's their training, it's their protocols, it's the unwavering strength of their team, and it's the mental resilience they are taught to build from day one. It is an entire architecture of support designed specifically to create order in the face of absolute chaos.